Nasal endoscopy. Nasal endoscopy is a minimally invasive procedure used by ENT specialists to diagnose and treat conditions affecting the nasal passages, sinuses, and throat. During the procedure, the doctor uses an endoscope, a thin tube with a light and a camera attached to it. The endoscope is gently inserted into the nose, allowing the doctor to see detailed, real-time images on a monitor. This helps in identifying problems more accurately and planning the right treatment. Based on its purpose, nasal endoscopy is divided into two types. 1. Diagnostic nasal endoscopy, DNE. This is used to examine the nasal passages to diagnose conditions inside the nose and sinuses. 2. Therapeutic nasal endoscopy. Therapeutic nasal endoscopes are used for treatment procedures. Why is nasal endoscopy done? Nasal endoscopy helps doctors diagnose and treat many nose and sinus-related problems, such as sinus infections, nasal polyps, deviated nasal septum, blockages inside the nose, nosebleed, addressing structural abnormalities, removing foreign bodies, abnormal growths or tumors. That's why when patients have persistent symptoms related to the nose or upper respiratory tract, nasal endoscopy is often one of the first investigations recommended by ENT specialists. How is the procedure done? The procedure is usually performed in the ENT clinic and takes only a few minutes. First, the doctor sprays a local anesthetic and decongestant inside the nose. This helps reduce discomfort and open the nasal passages. Then, the thin endoscope is gently inserted into the nostril. The doctor carefully examines the nasal cavity, sinus openings, and nearby structures. The procedure is quick and usually completed within a few minutes. Is nasal endoscopy painful? Most people tolerate nasal endoscopy very well. You may experience mild discomfort, pressure, or a slight tickling feeling. But generally, it is not painful because local anesthesia is usually used. In certain therapeutic procedures, general anesthesia may also be used. Are there any side effects of nasal endoscopy? Nasal endoscopy is generally a safe procedure with minimal side effects. Serious complications are rare. However, sometimes, the conditions being treated can cause side effects, rather than the endoscopic procedure itself. But don't worry, these side effects are rare and can be managed effectively in the hospital where the procedure is performed. Conclusion: nasal endoscopy, whether diagnostic or therapeutic, is a highly effective, minimally invasive procedure crucial for diagnosing and treating various nasal and sinus conditions. Its excellent visualization capabilities, minimal discomfort, and low risk of side effects make it an essential tool in nasal healthcare. So, if your doctor recommends a nasal endoscopy, there's usually no need to worry. It's quick, safe, and extremely helpful in finding the exact cause of your symptoms. To know more, please read our article, Nasal Endoscopy, Diagnosis and Treatment for Nose Problems. Link in the description. Stay healthy. Stay happy.